So if you just joined this live, please don't forget to like, comment, and subscribe. And please share this with someone because someone may also need this. If you have a sister, a brother, please don't forget to like, comment, and subscribe, and share with anyone who may need this. In the afternoon, we went live and I was talking about postpartum depression, which we talk about the 3 types of postpartum depression. And now we are going to the causes and the symptoms. But at first, we are going to look at the symptoms of postpartum depression. So, people with postpartum depression feel ashamed of their symptoms. They feel like they are terrible moms for feeling the way they do, although it's not their fault. People with these symptoms feel ashamed, they feel guilty for feeling the way they do because they feel like they have failed as mom or some, but it is not even their fault for feeling this way. Here are some of the symptoms of postpartum depression. One is feeling on edge. Feeling on edge, like you have had the last of it all. Feeling on edge. 2 is worrying excessively. Worrying about that thing, something that you shouldn't be worrying about, worrying for nothing. That is another symptom of postpartum depression. Like if you've had a baby and you're feeling this constantly, you may be going through postpartum depression. And the other one is, feeling worthless. Feel like you're nothing, you feel worthless. This is called this is a sign of postpartum depression. If you go through this experience after having a baby, you are going to postpartum depression. The other one is hopeless or guilt feeling. Feeling guilty, feeling hopeless, feeling like you don't have any hope in life, feeling so guilty. You may be going through postpartum depression. If you experience any of this after birth, then you are going through postpartum depression. The other one, which is the 6th one, is loss of interest in hobbies. The things you used to like or enjoy. You lose interest in the things that you used to like, the things that you used to enjoy doing. Now you lose interest in it. Like let's take for instance, you used to like music. Now you don't find interest in it again. Let's take for instance, you used to like watching movies. Now you don't find interest in it again. Let's take for instance, you used to like cooking. Now you don't find interest in it again after you deliver a baby. And it's not even because you don't have time to do so, just because you lose interest in it. This may be a sign you're going through postpartum depression. The other one is loss of appetite or not eating at all. And this is something that I experienced. I didn't feel the need to eat. I didn't feel hungry to be able to eat. I didn't feel like eating. Like I have food, but I didn't feel like eating. The only thing that motivated me to cook was my kids, so I just cooked for them. And so since I was not eating, my kids were also not eating well because I was not eating. So it was like we were all depressed after my husband traveled. And then let's go to the 8th one, which is trouble sleeping or not sleeping all the time. So if you have trouble sleeping after having a baby, you may be going through postpartum depression. And if you sleep all the time too after having a baby, you may be going through postpartum depression. So I went through both of them. I struggle to sleep at night, and in the morning, after I take my kids to school, I'll just be sleeping. And then let's go to the 9th one, which is difficulty in thinking or focusing. Difficulty in thinking or focusing. when you have a baby and you are finding it very difficult to think or to focus on something, you may be going through postpartum depression. 10 is losing interest in taking care of your baby or feeling anxious around your baby. Just imagine you've just had a baby. You are so excited. Like the joy a woman feels after delivering a baby cannot be explained. You feel so much joy. You feel so happy. You feel so excited. You feel complete. And then suddenly you don't feel the need. You don't feel happy again. You don't feel like being with the baby. You lose interest in taking care of the baby, or you feel anxious around your own baby. This may be a sign you are going through postpartum depression, because the opposite is you feel so excited. You enjoy every step of the way, although it is very, very consuming, time consuming, although it's very stressful. You still feel tired and proud to do everything because the baby gives you so much joy. So if you're not experiencing any of this, you may be going through postpartum depression. Thoughts of suicide or wishing you were dead. This is more serious. Like thought of committing suicide, thought of wishing you are dead. That is so serious. No human being will ever think that they are dead. So if you experience any of this after having a baby, you may be going to postpartum depression. And now let's go to the 13th, which is thoughts of hurting your baby or feeling like you don't want your baby. This is not real. This is postpartum depression. If you had a baby you love so much, so cute, so adorable, so beautiful, so loving, so kind, this little innocent baby, and you are thinking of killing the baby, you may be going through postpartum depression. It's not real. So when you experience any of this after childbirth, please contact your healthcare provider. It could even be your baby's pediatrician. You can talk to them. They maybe assess this and give you medication for it, because it's not easy. It's not good to feel the way you're feeling. Now let's go to the causes of postpartum depression. A lot of research needs to be done about, or to be able to determine, the drop in hormones after delivery and the causes of depression after delivery. And as I'm talking to you, there have been so many research and they still can't medically diagnose the causes of postpartum depression. But due to therapy and other consultation from doctors, research have conducted some symptoms or some causes of postpartum depression. But although we cannot medically determine what causes postpartum depression, now it is believed that the level of estrogen and progesterone increase tenfold during pregnancy. The level of estrogen and progesterone increase tenfold during pregnancy. Note sharply, but tenfold during pregnancy, but immediately drop sharply after childbirth. The level of estrogen and progesterone increase tenfold during pregnancy, but it immediately and sharply drop after delivering a baby, after childbirth, after having a baby. 3 days after childbirth, the level of hormones drop back to pregnancy levels. So after 3 days you have a baby, the level of estrogen also drops up again 3 days time after having a baby. In addition to these chemical changes, the social and chemical changes associated with having a baby increase your risk of postpartum depression. In addition to these chemical changes, the social and chemical changes associated with having a baby increase your risk of postpartum depression. These changes are: 1, lack of sleep. And lack of sleep can be caused by so many factors. Let's take, for instance, your baby cries all the time. Some newborns may cry all day long. So imagine if you have such a baby, you may not be able to sleep. Let's take for instance, you are just by yourself taking care of the baby and you have other kids like myself and you just work the whole day. You may struggle to sleep. And let's take for instance, I was struggling to sleep not because I didn't have the time to sleep, but because the sleeping I tried, but it was not working at all. So these are all the factors that contributes to lack of sleep during after having a baby. And my issue wasn't any of the things I mentioned. My issue was just not feeling, just not sleeping. The sleeping was not just coming. So the next one is physical changes to your body, worries about parenting. The second one is physical changes to your body. And the third one is the physical changes to your body after birth. Like we just mentioned, the level of estrogen and progesterone increased tenfold during pregnancy, but immediately drop sharply after childbirth. So all these changes causes postpartum depression. And the third one is worries about parenting, worrying about how you are going to cope. Like let's take for instance, when I was pregnant with my fourth and I had 3 kids already, anytime I see them, I just worried about how will life be after the newborn is born, after the baby is born. How will life be? How will I be able to manage all of them together? That also causes postpartum depression. Changes to your relationships. Like let's say you have marital issue. Let's say you have relationship issue with your partner, with your boyfriend, whom you had a baby with. This can cause postpartum depression. If you see any of these symptoms, notify your healthcare provider right away. So if you see any of the symptoms I just mentioned, notify your healthcare provider right away. And feeling depressed. So these are other psychological factors that are also factors of postpartum depression. One is feeling depressed most of the day or nearly every day for 2 weeks. If you feel so depressed for 2 weeks, you may be going through postpartum depression. Thoughts of death or suicide, you may be going through postpartum depression. Difficulty in thinking, concentrating, you may be going through postpartum depression. Affected by negative words, which is the fourth one, affected by negative words, you may be going through postpartum depression. Like I was saying about my own experience when I was pregnant, there were so negative comments on, like some people intentionally, and these are people that knew I was pregnant. Almost 77 ebia when you saw him a hano ebia yedija anase bisa anase obu also a make us say like my experience say doctor did the account one din ever comment here and very free no na the very free no e man who say hospital ya me ko doctor ya obo no na e yes na no after that and so yes I me see also be see section our second a story say oka so be go YouTube channel be go within a second oka say oka a story of a woman or walk away C-section. The woman didn't agree for the C-section. She and the husband went home. They came back later to do the C-section, and the woman died with the baby and all that, and she left her other 3 kids. And aside from that too, no, like all the comments that was on my video, noticing that it was him, no? And then they said he was going to do a C-section on me. So after having that conversation, I refused to do a C-section. And on my way to Confirmation Teaching Hospital to give birth, I also got another comment on the video saying, say, what if they steal your baby? And not cry alone, just say, in the panel commenting now hospital, because we free hospital work, and I'm able to be anyhow. And they comment, what if they steal your baby? Meaning, say, the person is dead. It means as you win pakra or yes, sir. All these negative things can cause postpartum depression. Into obia or sad if someone does this during your pregnancy, that's what they are wishing for you. They don't wish you well, or they wish that maybe you die during your childbirth, maybe something bad happened to you or the baby. And the person comment didn't surprise me at all, because I know that's exactly how they felt deep inside. They didn't just write it there, they felt it like that. And the other one is loss of interest in most of your daily activities for 2 weeks. Thoughts of harming yourself or your baby, social pressure. And these are some of the things that causes postpartum depression. Let's take for instance like a teenager who have just had a baby. Maybe the boyfriend that she had a baby with doesn't even work. The girl doesn't work, and she has become a pressure to the family. Like, let's take the family aside, especially in Africa here. Seven are not past summer. You spend it most of our time concerned. Any part was the people in the area will even gossip about the girl, the teenager who just had a baby. They'll talk negatively and all that. This can cause the girl to. This can lead to postpartum depression for the girl. Make us say, "Onipi." Nipa no so a wɔka no so wɔni bi na wɔde bi aboa no, but ɔbɛka asɛm, but meanwhile so the what the person have at home ɔno na this one ɛto no ɛte ne so wɔ fie koraa no wɔntumi nso ayɛ, but wɔbɛgya hɔ abɛka obi deɛ na ne deɛ ɔte ho deɛ ɔntumi ka. This can also cause postpartum depression. Ɛna the girl under 20 who have just given birth, a 19 or 18, a teenager who have just had a baby, not working, the finances can also cause postpartum depression, because such a girl doesn't have any work, and the father of the baby may also not be working. This can cause postpartum depression, because we know the finances of having a baby in Africa, in Ghana here, like buying a diaper, feeding the baby, and all that other expenses. This can cause such a girl to get postpartum depression. If she doesn't have any financial support from anyone, she may get postpartum depression. And that's why you usually hear that a teenager have just given birth, they drop the baby in the abusing and all that, because of they cannot take the financial activities after having a baby. They cannot do that, and they have the idea of throwing the baby away. That's why you usually hear stories of a teenager who have just given birth and dropped the baby in a WC. So these are all the things that causes them to do this, because they are under social pressure. Everybody expecting them to live a perfect life. Everybody's expecting them to, to be able to cater for the kids when they don't have it, and they don't have any other financial support from anyone. They may get postpartum depression. So if you know anyone like this, and you may be able to help them financially, fine, you can help them. But if you cannot help them financially, please allow them to be. Don't say any negative words to them, because you may affect them psychologically. And the eighth one is feeling anxious, guilty, hopeless, scared, worthless, or panicked. Like, I was scared when I had comments. I wish your baby die. I wish you die. I wish your baby gets autism. I wish you live for life and all that. I was really scared when I was about to give birth. And so feeling anxious, feeling guilty, feeling hopeless, feeling worthless, feeling scared and panic is a factor that leads to postpartum depression, or it's also a symptom of postpartum depression. So if you know anyone who have gone through this, they may be going through postpartum depression. Now let's go to the other one, which is, can this affect your baby? Yes, it can. This can affect your baby very negatively, and let's see why. Getting treatment early is good for you and the baby, because this can affect your baby. Researchers suggest that postpartum depression can affect you and the baby in the following ways. One, you may skip appointment with your child's pediatrician if you are depressed in the house. If you are going through this, let's say you are going through financial hardship after having a baby. Let's say you have a baby with special needs and cares, like I said earlier, in the first life, like people who give birth to, excuse me to use this word, autism baby, Down syndrome and all that, they may get postpartum depression, especially in Ghana. If you have such a baby, they say that akwani flu suas ne bae or mama wataba and all that. So this can also make the mother get postpartum depression. So let's say if you have a baby with special needs, you are likely to even skip appointment with your child's pediatrician due to the way people will react when they see the baby. Due to the words people will say to you, the look of sympathy and all that. Some people don't like to be sympathized, like to be pitied, and they may feel like they may rather stay at home than going out, and they may skip appointments with the child's pediatrician. So the second one is just your child may be at a higher risk of obesity and developmental disorders. Your child may be at a higher risk of obesity and developmental disorders. Like if you are breastfeeding and you, the parent, is not mentally stable, if you are not physically stable, if you are not eating well, or you are not physically or mentally stable, it might affect the baby. You know that depression causes obesity, and the baby too may be obese. If you are depressed, your baby too will be depressed. Because there's something that I noticed when I was going through the postpartum depression. My baby was not active like she used to be. So when I call my husband and I'm talking with him, I told him that the baby doesn't like act. Even when she's doing tummy time, she was not acting the active way she was before. So I noticed that something was not right with the baby as well. So whilst I was going through depression, she was also going through the same thing. So the third one is you may have trouble bonding with the baby. And this is very important. When you have a new baby, you are your baby's secure place. You are the only person that your baby knows. The baby knows your smell, she knows your aura, she knows everything about you. The baby loves you, the baby know that they are secure. They know your voice, they know the sound of your voice suits your baby. The sound of your voice makes your baby feel secure. So if you are not in a good state after having a baby, if you are not mentally stable, if you are not physically stable, if you are not psychologically stable after having a baby, this will affect your baby's uh, this will affect you bonding with the baby. You may not feel the need to bond with the baby, but it's very important for the mother or the father to bond with the baby after the baby is born, because this helps your baby cognitive development. Now let's go to the fourth one, which is you may not establish a strong connection with the baby. Like I said, if you don't bond with the baby, you'll not be able to establish a strong connection with the baby, and the baby needs that connection. And now let's go to the fifth one. Your child may have social skills. Impaired social skills. So this may delay your baby's milestone. Like your baby needs to be able to, walk. Your baby needs to be able to crawl and all that. So this may delay all of that, or it may even your baby may not be able to experience the crawling, the walking, and other things, other milestones that your baby needs to meet, just because you are going through postpartum depression. That is why it's very important for you, the mother, to be very well when you've had a baby. So the moment you experience any of this, go to the hospital to be assessed and you know treated with medication, and this will come to an end. You'll be able to feel normal, and you'll be able to be born. You'll be able to bond with your baby and create a strong connection with your baby. Let's go to the seventh one. Your child may have feeding and sleeping problems. Yes. Maybe you are not eating. Your child may not be able to eat as well because they don't have enough milk. Because you need to produce a lot of milk for the baby. Like if you were doing exclusive, like myself, you may need to eat well. You may need to eat enough to be able to produce milk for your baby. So if you're not eating well, the baby may not also be eating well. Or maybe since you are depressed, you will overfeed the baby just to make the baby calm or quiet, so you'll be able to get rid of the baby. Or if the baby cries a lot, you may overfeed the baby to shut the baby out, because you don't want to hear anything about the baby. And this may have feeding and sleeping problems with the baby. So let's go to the eighth one, which is you may not even recognize when your child is sick. You are not concentrating. You are not physically stable. You are not emotionally stable. You are not psychologically stable. You are not mentally stable. How can you even see when something is going wrong? You will not be able to know when the baby is sick or not. But thank God I wasn't there. I didn't get to that stage, in Jesus' name. And let's go to the factors that increases your risk of postpartum depression. One is marital or relationship conflict, which we just mentioned. And the second one is pregnancy complications like health conditions, difficulty in delivery or premature birth. People below 20 or above, which is the third one, people below 20 or above 40 years can also get postpartum depression. I think I already explained that when I was talking about teenagers, know that when they get pregnant without financial support from anyone, maybe the father of the baby is just also a teenager with no job, they may get postpartum depression. The woman may get postpartum depression. She doesn't have any emotional, social, or financial support from anybody. She may get postpartum depression. So The fourth one is having personal history of postpartum depression. Like if you have a personal history or family history of postpartum depression, you are likely to also get postpartum depression. So I have had postpartum depression before, so it wasn't really surprising when I had postpartum depression, but this time it was postpartum psychosis, which is very severe. And I've never experienced a postpartum psychosis before. Like I said, I held my baby running away from the house like someone was after me, like something bad was about to happen to my baby. So I held my baby. I took my baby to a neighbor's house and told my baby her to hold my baby for me because my baby may get hurt or something. The other one is the fifth one is having family history of postpartum depression. I think I've already said that. And the sixth one is limited social support. I already said that. Seven, having a baby with special needs or a baby who cries a lot. I already explained that. A baby who cries a lot. Some people may not be able to handle that. Having a baby with special needs or a baby who cries a lot. Some people may not be able to handle that. And this may lead to postpartum depression. Like if you are a first time mom or second time, the cry may be a problem. You know, sometimes not every cry of a baby, some cry are just a tantrum, and then they'll cry and you notice that it's just a tantrum, you don't pay attention. But sometimes the crying is very serious. So if you have two or more, you may be able to differentiate both. And sometimes you may not take some of their crying very personal. And if you have not if you are not being able to differentiate, you may take every cry so personal that it may lead to postpartum depression. The seventh one is having a, okay, I think I mentioned that. The eighth one is premenstrual dysphoric disorder, PMDP. PMD, premenstrual dysphoric disorder. This can also lead to postpartum depression. Please hold on. Okay, guys, thank you for the like. Keep liking and sharing. So let's premenstrual dysphoric disorder, which is the premenstrual dysphoric disorder is a behavioral symptom that usually resolves with the onset of menstruation. A premenstrual dysphoric disorder is a physical and behavioral symptoms that usually resolve with the onset of menstruation. I think this is when after the baby you immediately get menstruation. This can lead to postpartum depression. Let me tell you, trust me, it can lead to postpartum depression. I need to go and sleep very soon because my kids are sleeping. My baby will wake up very soon for a feeding. I don't know if I lost my microphone again. Okay, I found it. Guys, I don't know if all the things I said came in the live video. My microphone is low battery, but I charged it after I went live. Okay, it's so I can do. Okay, all right. So let's go to the diagnosis and test of postpartum depression. How is postpartum depression diagnosed? There is not a specific test that diagnoses postpartum depression, like I said earlier. It cannot be medically detected. Your healthcare provider will evaluate you at your postpartum visit. This may include discussing your health history, how you felt since delivery, a physical exam, pelvic exam, and lab test. Many providers schedule visits at 2 or 3 weeks postpartum to screen for depression. This ensures you get the help you need as soon as possible. They may do a depression screening or ask you a series of questions to assess if you have postpartum depression. And this is the time that you need to be honest with your healthcare provider, so they may be able to know whether you're going through postpartum depression or not. They will ask how you are feeling and how your baby is doing. Be open and honest with your provider to ensure they get an accurate picture of your emotions and thoughts. They can help distinguish if your feelings are typical or symptoms of postpartum depression. So after you answer every question they ask you, after you express exactly how you're feeling, they may be able to they may be able to detect if your feeling is just a typical feeling, or your feelings are typical or a symptom of postpartum depression. Your healthcare provider may order a blood test because postpartum depression can cause symptoms similar to many thyroid conditions. So these have similar symptoms to other conditions. So they may you may do a blood test to be able to detect that. Remember, your healthcare provider is there to support you and make sure you are healthy. So be honest with them. There is no judgment and you aren't alone in your feelings. Yes, your healthcare provider should be a friend. They may be able to understand. They should be the first people to understand this. So if your healthcare provider doesn't understand this, then I don't know, maybe they have a problem worse than yours. So they should be able to understand this, and they will understand this. They are there for you and they understand your feelings, and they are not judgmental on this. So how do doctors screen for postpartum depression? It can be hard to detect mild cases of postpartum depression. Healthcare providers rely heavily on your responses to your questions. Like I was saying, you need to answer the questions they ask you correctly, which I think I had a problem when I was pregnant and I was bleeding. The doctor said maybe I was bleeding because of sex, and I said it's not because of sex, because we've not had sex. I think that made him very offended, because, but that was the truth. I was saying the truth. I don't know if I should lie to make him feel comfortable. So many healthcare providers use the Edinburgh Postnatal Depression Scale to screen for postpartum depression. It consists of 10 questions related to symptoms of depression, such as feeling unhappy, anxious, or guilty. They are they will ask to check the response that comes closest to how you felt the last 7 days. A higher score indicates possible postpartum depression. If your provider feels you have signs of postpartum depression, they will recommend an appropriate treatment. Okay. Now let's go to the management of and treatment. How is postpartum depression treated? Postpartum depression is treated differently depending on the type and severity of your symptoms. Treatment options include anti-anxiety or antidepressant medicines, psychotherapy, talk to a therapy or cognitive behavioral therapy, and support group participation. Treatment for postpartum psychosis may include medication to treat depression, anxiety, and psychosis. You may also be admitted to a treatment center for several days until you are stable. If you don't respond to this treatment, electroconvulsive therapy (ECT) can be effective. So if you are breastfeeding or chest feeding, don't assume that you can't take medicine for depression, anxiety, or even psychosis. Talk to your healthcare provider about your options. So though I was breastfeeding, I was given medication, which was really helpful. What medication can I take for postpartum depression? This is something I cannot say. Your doctors will be able to give you the medications you need for postpartum depression. Keep in mind that it takes at least 3 or 4 weeks for antidepressants to work. Talk to your healthcare provider before stopping the medication. Stopping your medication too soon can cause symptoms to return. Most providers will recommend reducing your dose before stopping completely. If your provider detects postpartum depression while you were still in the hospital, they may recommend IV medication containing bresanolone. bresanolone. And what are ways to cope with postpartum depression? Okay, so it's okay to feel overwhelmed. Parenting is full of ups and downs, and having a baby isn't easy. If you have depression, you don't have to suffer alone. Your healthcare provider can help find a treatment that works for you. Here are some things you can do to cope with your postpartum depression. Find someone to talk to, a therapist, a friend, a family member, or someone who will listen to you and someone you trust. Like I was saying, find someone who will listen to you. And just listen to you, I think, is very therapeutic. It will help a lot. And someone you trust. When I say someone you trust, not a gossiper, someone who just listen to go and say it. Don't tell someone like that. Find someone you can trust, you can share your feelings with, and you know that it's secure with them. And someone who is reliable, and someone whom if you talk to, they may be able to find solution for you without. Don't just talk to anyone. Obi a ontimi mmoa wo enkoka wo problem enkyere no. Ukoka kyere no kwa wo de uka ya wo de woko. Because say maybe I will be information there. If you don't touch a person, you shouldn't talk to the person. Talk to someone who will listen. Someone who is reliable. Obi a na no ato a obetimi aka na no ato nye de obetie di akomo obi. It is that person. Don't talk to that person. Talk to someone who can help you. Someone who have had your experience before. Or someone who can put themselves in your shoe. Talk to that kind of person. Join a support group for new moms. There are some groups for new moms. Like there are so many social media platforms. Like I think there's this social media platform on Facebook, Toilet Moms, where you can see so many moms there. Like I think 99% of the women there are moms. So you can go there, you can hear people's story, you can have fun there, you can listen to people, like listening to other people's experience alone can make you even feel better. Like you see cases worse than yours and you feel better about yourself. So you shouldn't just associate yourself with anyone. Find someone who have also just given birth. They may be able very they may be able to relate to you. Don't just speak to anyone. The third one is prioritize your rest for yourself. Your rest should be a priority. Like you should take time to rest. This is where a lot of women feel guilty when they have a baby. They feel like it's a crime to rest because they've just had a baby. They feel like they should be active the whole day. No. You need to rest. You need to take time for yourself because if you are stressed, how are you going to take care of the baby? That's why there are so many chores in the house that you need to ignore a lot of them. Do what you can do at a time and leave the rest. You can do it the next day. You need to start learning distance, especially if you live in Ghana. Don't If you know there's a visitor who is coming to gossip to see how your home look to go gossip, don't open the door for them. Or if you don't have a problem with them seeing your home, it's okay, let them come in. But you cannot do everything. Especially if the person who is coming in doesn't have a child, they will never be able to understand why your home is like that, why your home is messy, because they don't have a child and they don't understand. Some people even don't know that. Like let's take for instance, we have changed our living room furniture severally because of our kids. Someone who have not had a child will not be able to understand. That's why when you are a mother, you should also associate yourself with other mothers. So don't do anything that you think is beyond you. Do what you can do at a time. The next day you continue. That's why in Europe, some people when they give birth, they wait for about 3 months for family visits. Akwesi Broni were checking in now or planning beer. Everything they do is for their peace of mind. I say it. Would do stage be in life, you realize that peace is very, very, very important. It's valuable and it's very expensive. It's anything that will cost your peace, no, I ignore. Then you take the things that will make you peaceful. So that the one, two, three, four, five. The fifth one is go out with your friends or talk to them on the phone or even chat with them. Go out with friends, talk to them on the phone, chat with them. This will make you feel okay. So when you have a baby at first, you feel like the whole world have ignored you. You don't have to feel like that. You need to call your friends, call family members, call loved ones. Don't feel like you are alone, you've been ignored and all that. The sixth one is find time for self-care and doing things you enjoy, like reading or other hobbies. Like all the things that you used to like do them. Like if you have like if you have baby, it's very difficult. When I had my baby at first, especially when my husband traveled to Canada, like it was hardly a burden for me to go out and wash my hair. And I think my shampoo, my conditioner was finished, so I only used the shampoo to wash my hair, and it wasn't looking well. But for me to go to a salon to sit down for about 2 hours to do it, it was very difficult for me. Going to the salon to do my nails, which I love, I was finding it very difficult until my mom came in to assist me. Then I was able to do all those things. So if you get the time and if you get someone to assist you with the baby, you can go out and do all those things. If you feel like going out to a restaurant to eat something, you should just go out and eat it. If you feel like having dinner with your family in a particular day with no cooking in the house, you can do that. If it makes you happy, it gives you some peace of mind. If it gives you some rest, do it. And if you are a husband who is watching me and your wife have just given birth, you know you should understand that they need a lot of rest, they need a lot of peace, they need a lot of assistance. I know a whole lot of men who wants to do this. They want to help their wives at home. Seriously, a lot of Ghanaian men, a lot of men want to help their. Europe, there is normal for a man to assist his wife. In Europe, the men take the rubbish outside. But in Ghana, if the man does that, the workers will ban quite a true. Even so, any panel yes and can the baby, I worry and can yes, a man can benefit. But a lot of Ghanaian men wants to do that too. But they need panel back count the society in back count. Some cultural beliefs here aka yetima e high and non tino or person back of ferry said the back empty. So a lot of men want to help their wives, but they cannot do it because of ferry. But that man is not shy of that. He's not afraid to do that. It is the woman who have just given birth need a lot of rest. They need assistance. And now you will be so our down for biawo, or sister biawo, like woman biawo. They don't need you to hold the baby. They can hold the baby. And yeah, near them. What they need is someone to help them with the house chores, not someone to hold the baby. They can hold the baby. So if you go to someone who have just given birth, the best thing you can do for them is to help them with the house chores. Okay, so find time for self-care and do things you enjoy, like reading or other hobbies. I think I mean, get help with the household chores and errands, like I said. Get help with it. If you need a house help, I was, I was, I always said I will never get a house help, but I think I need one now. And the other one is what happens if postpartum depression isn't treated. Untreated postpartum depression is dangerous and affects you and your baby and those who love you. It can make you one moody. Two, you feel like you have no energy. That was exactly what I was going through. Believe you can't take care of your baby. I was also going through the same thing. Unable to focus or make decisions that I wasn't going through. Have thoughts of hurting yourself. I never went through that. But believe you can't take care of the baby. Being moody and feel like you have no energy. I was experiencing that. Prevention. Can postpartum depression be prevented? Postpartum depression isn't entirely preventable. It helps to know warning signs of the condition and what factors increase your risk. So know what the things that causes your postpartum depression so that you'll be able to prevent it. That's why I said in the other live video that one of the things that causes postpartum depression in my life is when I gave birth, everybody was like, everything I do, everybody was saying that I don't know. They wanted me to do things the way they wanted to be, instead of how I want my baby to be, instead of how I want to do the things. It's not like the way I wanted to do wasn't right, but everybody was telling me, "Wait, I need to say," and I went to one and that's like, I don't know. Instead of it's if it become an issue, like everything, every day there's an I'm away, and I say one. I didn't want to hear all that, so I talked with my husband. I said, at this time, please, when I have the baby, I just want us to be just you and me, until my husband traveled, because I wanted a peace of mind. So when I noticed the things that caused the postpartum depression, I was like, wow. So this time around, I'll choose peace over everything. And that was really working for me. So when my husband was here, I was 100% okay. Until my husband traveled and I was alone with the kids. So, like I said, postpartum depression isn't entirely preventable. It has to know warning signs of the condition and what factors increases your risk. Here are some tips that can help prevent postpartum depression. Be realistic about your expectations for yourself and the baby. Like if you have, these are the things I think I mentioned. Don't have a higher expectation of yourself after having a baby. Say, hey, like in Africa, Ghana had it. They say a bone no also dry over. Me, for instance, they do maybe call at 10 p.m. now for the midwifery and a dry. If you are an upper bed 12 now for the midwifery. That's the reason why I'm just myself and my husband, because I don't know be a machine times and upon also driver. Maybe another at 6 o'clock that a cultural beliefs in the Indian be another time unya make us say what the crowd sorry make us say I want that bed 3 p.m. 3 a.m. maybe I will die. Then you slept around 3 a.m. you wake up at 8 a.m. or maybe you woke up at 10 a.m. Let's take for instance, if your kids doesn't go to school, maybe your kids are on vacation, maybe you slept at 3 a.m. Me for instance, that I'm on YouTube, I do a lot of research and all that. Sorry, sometimes I don't sleep early when everywhere is quiet, when they are all asleep. That's when I have a very peaceful environment to be able to think, to plan my videos, to know what to do research, to know what I'm going to do. Sometimes no, if my kids don't go to school, sometimes I sleep around 3 a.m. I'm sorry, bed 10 or 11. So how do you expect me to someone who slept at 3 a.m. to wake up at 6 to bath a newborn baby? Me driving a 10 at home, me driving a 10 at home. So they may say that's the same way I'll bath the baby at 10 p.m. So why the ayama it just a hanipa. Also no sense if you are going to work, that's different. And I'm so YouTube so I do all my research, I also learn at the middle of the night. So that time, how do you expect me to wake up at 6 and be there until when my kids reopen school that I wake up around 4 a.m. So I have to sleep much earlier because their bus will arrive around 6:30. That one I have to sleep. So when they were on vacation, I used to wake up at 11, sometimes 12. When I get up, then I hit water and I bath my baby. Then I feed my baby and I also find food for my kids because not knowing now sorry. But after they resume vacation, I have to wake up 4 a.m. So what I'm trying to say is that men can say, Obi say, me there are times that there was a time I was drying my clothes at 2 p.m. So woman she was a tenant in a neighbor's house. When I was drying the clothes, my husband who is married to me, he doesn't have any problem. But someone who is living somewhere, no problem, send me her time never 2 o'clock. That's all her time never 2 o'clock. They are on your wife material. Bounce or 7 or her time never a match 5. So I'm not saying worrying. There are certain things where don't let them get you. Don't take a money how say will be say why they say one time saying it. Wouldn't depend, you will die and leave your kids. Do what you can do. Just a woman now over brand who say You know that this is what I do that helps me. Do that. Don't do what everyone is telling you if it's not working for you. So if you are someone who is working from home like myself, and that was sorry, you make us what about 3? No, sorry 6. Obey yare, you get sick. And please do what works for you. Patty, do what works for you. Be a candidate. But the panel can the only shoes. Now, if the person was in your shoes as well, can they all in no even obey because no yet no better. Be a no better. Maybe we can't just say, no, no, the panel better. Yet they also better. What it? So don't overstress yourself. Don't overdo it. You need some time to rest. This is the other one is the other prevention is sleep or rest when your baby sleeps. This is the most difficult part, especially if you just had a newborn baby and if you don't have any social support and your baby sleeps. That's the time that you'll be doing all the chores that you need to do. But it says here that sleep whilst the baby is asleep. When the baby is awake, you can put them in their bassinet, you can put them in the baby romper, anything at all. Just anywhere that the baby will be able to relax whilst you do your chores, because you have to sleep when the baby sleep. When the baby is awake, it will be very difficult for you to do the things that you're doing, and it will be very difficult for you to sleep. So when the baby sleep, you also sleep. When the baby wake up, you do the things that you need to do. Keep in touch with family and friends. Don't isolate yourself. Yes, you don't need to isolate yourself. After having a baby, feel like everyone have ignored you and you may feel like isolating yourself, but you have to keep in touch with friends, loved ones, and family members. Foster your relationship with your partner. Make time for each other. In Europe, after having a baby, they go on vacation. You can go on vacation. You don't necessarily have to pay for an expensive vacation. Just go to a nearby hotel, maybe a guest house, to spend just 1 day there with the husband and the kid. Or go out with husband for a date night, or maybe a brunch or anything at all. As that anything that's far from home, your usual or familiar place, that any different environment from your home is very therapeutic. If you do this after birth, this also releases a lot of stress from the newborn, the new mom, and it also helps the bond of the relationship. Expect some good days and some bad days. It's normal to have some good days and some bad days after having a baby. So what is the outlook for women with postpartum depression? With professional help, almost all people who experience postpartum depression can overcome their symptoms. That's why you should call your doctor or you should speak to a therapist. Okay, so like I said, do what you can, do what works for you, not what everyone is saying. There are so many ways to release stress. Why stress yourself? Me, for instance, when I feel stressed, I just calm down, I relax. I just sometimes now I don't have time to watch television like I used to. Now I don't have time to do other things that I used to because I'm so busy with the baby and all that. But it's fine. Now let me tell you guys, there are some television shows that I watch on UTV, TV3, and GH1. These telenovelas, I love them. So when I watch them, it relaxes me, it calms me, especially Emilia on UTV. You can watch it if you like movies like myself. Sometimes you watch movies from Netflix. You don't need to stress yourself. Having a baby, yes, is very, very demanding, but you don't need to kill. If you die, what will happen to the baby, the newborn baby, and your other kids? So you don't need to overstress yourself. There are so many chores that I have in the house. I have so many things to do. Trust me. But I was able to do about 2% of them today. And I'm not stressed. I'm relaxed. At first, when I say it like that, I feel stressed. But no, I'm not. Because I know that I can do it the other day. And I'm here with my kids. And anyone who comes here will understand that I am a new mom. Yes, you have to understand. That's why you have to find someone who is very relatable. Obi wɔ hɔ ɔbɛsra wo a ɔbɛhwɛ nneɛma ɛde kɔ. Obi wɔ so ɔbɛsra wo a they understand. Tipe nipa na adwene mu bie a n'ani da hɔ no ma ɔba a ɔbɛte ase. Obi asɛbisɛbi ɔnwo yɛ no ɔnte ase. Me first na me nwo yɛ no. Me hu ɔba bi kɔ a wo kwa na hu yɛ sam. Na de nkwa no. But wo a na wonya sa experience na wo say sɛ nyɛ and your friend you feel. That's how it is. And maybe what don't stress yourself. Don't try to please. Who are you trying to please? Maybe when my husband will say he understands everything. So who are you trying to please? Don't overly stress yourself. You may die and leave your kids. Yes, so don't stress yourself. Say moving out, watch a movie. If you want to go out and get yourself a new look, go. You see, I want to go and braid my hair, but I don't have time. I plan on doing it this weekend or Saturday. I couldn't do it, so I've postponed it to next week by God's grace. It is sanity. And then we break yes, you can, but don't stress yourself. Don't kill yourself. Man, so don't stress yourself. Don't kill yourself. Don't overly do it. First, now I let something gets to me now. Oh, but now I don't care. I don't care because at the end of the day, it's about me, my kids. They're the most important to me. My husband, he understands it. The one who should care, he understands it. So what's the baby? Say how? So now problem. It's not me. So why should I worry about that? So don't me say I knew someone. It's salon and going to sister. So I know what did the madam not tap and a madam way. Then we will buy them when the prince and the crew are right. No, I don't want my order. Was only that time a corn and hall cry and a poor whom ya cock and a hall cry on prow. Whom ya redeem cannot pack it back and I say, oh, madam, no. Time now corn hall now was an past 7. I'm say. Tiana past 7 no. Will be all my baby and son. Cowcast on Conanco cleaning baby. Or send us so bad and I'm so bad. Who know him cleaning you out away. The woman's car she's using crano. Won't me to Niku the Tomam. Into your bar won't me about 7 on plan in living room. None it creates me out of such an expensive car, man. Now what one say, oh, Madam Crow who did tell Niku Warreno. Are you are the one with the problem. The husband loves and respects her even though she has not cleaned her living room around 7 a.m. Also, I'm cleaning and I'm and near me do a money how young and near me point send to Uncle Foka. No, what's nothing. No, I evaluate, no one will say. As soon as me say, this is the reason why I'm kind to Sana who evaluating the Sana and how P. Sana is sending me one. He said, Name will also ignore the real say quantity, a brabonne quantity or minor quarter. And it may be a to be bim. Oh, dream the open because no could be sad there. They were trouble questions. The bed 10 cities and 20 days. Now, Barbara Dream. Don't think about that. Now, oh, Barbara Dream will be once, will be a small count. Anytime you need to be out one, oh, dream never be improve life. Neddy will be cat because Nipa now will dream the organ wire the opera man. Or no, where they or no, or pay any the web one. Sleep I saw where they or no pay. They also a bed one. And I about to so I got to me power show. Yeah, my Ghana, you need baby, I could be. Yes, and to come back. Near Cassie Jania, oh, no, Mukwa, no, Mumma. Don't be quite go with cheese here. Now, make us say, out to a class where you are broken soon to move. Nurse, Obaka conto quack when you ask my say was a patcho. Coto, Maddy open ask them. The old disobeyed me a woman, got my name it here. In them got to a man. We were 18 years ago, I will be pressure me. They made to man or margin. Obeying them to man, bank or to man, they may pay. Those are not pressure on Usana if he is tomorrow and to madam. Who's what to only purpose or cotuman. Transwan could you be a sick as or cotuaman. Seni pan or baby had a party to over most cassette to man. Baby, well, they could choose it up at the end of the day. Young coupon a beji dear. Or Sawopa. Tipa we want to say Nipan open your coupon manner and can a coma. Nadia be dibia with Jacka. You see a beard. A tipa one also was a radi and can Nipanacoma, no mayor or mine is ye. And no one no. Any quite so cocoon toka, and away free her, and away free her say, no way me crummy, no way I say, it's not important. But we are not free. Or more also more kind of behind. And you're not kind will be. Thank you so much for watching me. I believe that this video was very helpful. I believe you are listening to my advice. Take it. I'm telling you from today. Take it. Me yi many free name be so I'm concentrating on my own life na so aboa me pa ne e bie kwan bebra ama me time na me dwene mkrofo ho ase na me ni once the kwada bank account ne me yi many free mkrofo so I'm concentrating on my life no it have helped me a lot. Ain't me so anyone being impressing is God. God is the one you should impress. Aside from that no so your parents are oh ye maybe an hour dream the beboa wo ma ho. Na aside from that, once I dream the beboa wan kasa won so ni padua na beboa wan kasa wo nipa no so ebe yama. Na aside from that nipa na wo bekwa akwadwe no ho no ono wote ni fie wo dream the beboa no wo dream the no ebe ma no ho ato no. Na sa wo bekwa akwadwe no akoye de ebe ma nipa akro no ho ato na ye wo wasem. Because one year they are better or they are not better. So I believe this video was very helpful. Thank you so much for watching, and I believe you're taking note of so many things. So I'll see you all again in another one, but until then, bye.